Assalamu alaikum, the communication day. The first scenario, Mr. Sami, 55 years old, has advanced Parkinson's disease and struggles with the medication, with side effects from the medication. He is being referred for possible deep brain stimulation. Please talk to him and address his concerns. Are you ready, Dr. Sarah?
Yes.
Okay, here you go.
Okay. Hello.
No, doctor.
I'm Dr. Auda Karim. I'm one of the doctor covering the nerve clinic today. May I confirm that you are Mr. Sami, 55 years old?
Yes, doctor, I am Sami.
Mr. Sami, we are here to talk regarding your health condition. Is that okay with you?
Yes, doctor, thank you very much.
Just to be in the same page, could you tell me how much you know regarding your health condition?
Yes, doctor, what I have known is that I have been diagnosed with a disease called Parkinsonism disease. Parkinsonism. I tried and I tried many medication, but this medication have a lot of bad effect. So the consultant, I think he need to try another medication for me. So I am here to know if there is any new medication.
Mr. Sami, thank you for sharing this information with me, and I'm sorry for suffering.
Thank you, doctor.
Yeah. Before I will explain to you regarding the further plan for your management. So do you want from me to explain to you regarding the Parkinson's disease?
No, doctor, I know the Parkinson's disease. I have been complaining since 4 years, so I know it this disease well. Thank you, doctor.
Okay. So, Mr. Sami, yes, now our consultant, after assess your conditions, yes, they assume that you have been troubles with some side effect of the medications. That's why we decided to do for you some procedure in the best interest of your condition, which you call the deep brain stimulation test.
Procedure?
Yeah.
It is surgery, doctor. I suppose it was a new medication, but I don't know what is procedure done for me. It will done for me.
Yeah. I understand your reaction and your worries, Mr. Tami. Yes, this is one of the procedure, just to look like a simple procedure. So do you want from me to explain to you more regarding this?
Yes, doctor, sure, please.
Yeah. In such a situation, when your condition become not controlled with the medications, and also as in your condition now, you have been troubled with this side effects, there's another options which we call deep brain stimulation test. And this deep brain stimulation procedure, this will be done by expertise team who did such procedure many times before. And before this, just we need to assess you, and we need to to be sure that you are fit to do for you this procedure. And Mr. Sami, yes, the importance of this just to control your conditions. And so now we are trying to draw for you. Please follow me.
Yes, doctor.
To make it simple to understand you. Yes, imagine with me, this is your brain, and actually, as in your problem, there is a deficiency or damage in a specific area in the brain, result in the deficiency in the protein, which you call dopamine in your body. This protein is the most important to regulate the electrical impulses in your brain regarding the way of the movement and others, the muscles also. So this procedure in which the device before this we will give you some sleeping medications to keep you calm and avoid any pain that it might be happen for you. And this procedure in which there is some device or some some device should be some wires should be inserted into the brain in this area and connected with the device, okay, either in your upper chest or in your tummy. The aim of this is to control the electrical impulses to way that can prevent these complications and this slowness of your movement and other complication in your conditions. Are you understand me, Mr. Sami?
Yes, doctor, I follow you. Yes.
Yeah, so Mr. Sami, this like any procedure, it has bad effects besides its good benefit. One of these, it can cause sometimes some like injury and an infection sometimes and bleeding. But be sure that this is rarely to happen because this should be done by expertise hand. And also after that, we need to keep you here in the hospital and we need to follow you. And at any time, if you are develop any kind of complications or side effects, we will treat it appropriately. Mr. Sami, are you following me?
Yes, doctor. Yes, I follow you.
Okay, so what do you think regarding this procedure, Mr. Sami?
Yes, doctor, I have read from it is a surgery in the brain, so it is very difficult for me, as you know.
Yeah, and
Yes, doctor, but I have a question.
yeah.
Yes, is this procedure will cure me from Parkinsonism?
Mr. Sami, your concern is valid and I understand your worries regarding your conditions, Mr. Sami. Actually, regarding this procedure, it's not like a curative for your conditions, but just we need to control your symptom and your complications that it might be happen from this problem. Just this procedure, it can help you to live like near normal life. So I think it's most important for your conditions now. So what do you think, Mr. Sami, regarding this?
Okay, doctor. So it will slow the progression of the disease because, as you know, this disease is progressive increased with me. So it will decrease the progression of the disease.
Yes, I highly appreciate your concern, Mr. Sami. Yes, regarding this, yes, one of the benefit for it, just to control your conditions. Yeah.
Okay, doctor. Very good. So it will decrease the progression. Okay, doctor.
So,
So I will think about that this procedure.
okay, so Mr. Sami, if you are agreed to do this procedure, we need from you to sign a consent, which involved with, which is a formed document involved with all the information that was mentioned to you, and the benefit and yes, and the complication of this procedure. And also, you have a right, if you are change your mind at any time, to withdraw from this.
Okay, doctor.
So,
So can I think about that and tell you?
yes, Mr. Sami, yes, you can take your time and you can think, but we advise you to not waste most time because your condition we need to control it as soon as possible. Is that okay, Mr. Sami?
Okay, okay, doctor. Thank you. I will think about that. Thank
Okay.
you.
So, Mr. Sami, may I ask you what you are doing for living?
2 minutes left.
Yes, doctor. I am retired now. I was
Okay.
yes, I was a teacher, and I am retired
Mm-hmm.
now.
I'm sorry, Mr. Sami. I know your condition, it impact your job and your daily activity. But Mr. Sami, do you need any kind of help like social or financial support from us?
No, doctor. Thank you very much. I have my wife. It is a good wife. Thank you very much.
Okay, with whom you are living?
Yes, was my wife.
Okay, so anyone able to take care regarding your conditions and yourself?
Yes, doctor. She is able to support me and take care of me. Thank you very much.
Okay. So do you drive?
Yes, doctor.
Yeah, so yes, do you think your condition affect your driving?
No, doctor. No, I think I drive well.
Hello?
Yes, I drive. No problem with me about driving.
Hello?
Yes أنا سامع كويس.
You are hearing me? Okay.
Yes, yes
So we
دكتور سارة.
advise you, Mr. Sami. Yes, we advise you, Mr. Sami, to stop driving until your condition become control. Okay.
Okay دكتور. Okay, thank you.
So I'm sorry for that, Mr. Sami, because your condition it become like advanced and in progression stage. So just we need to think for the future plan of your management instead of you are not able to do it.
Why doctor I am going to die?
Mr. Sami, not like that, but just to before yes, just to think regarding the situation in the future because
Okay
your
doctor.
condition, yeah.
Okay doctor, I will
Okay.
think about that. Thank
Okay.
you.
Okay.
So I will provide you with brochures and trusted website to read more regarding this procedure and how much it's important and so benefit for your conditions now. And this is the contact number, Mr. Sami. If you are need any kind of help or any you have any queries, please don't hesitate to ask us at any time.
Thank you doctor, but you forget the concern. Concern.
Concern؟
Yes, you didn't tell me what is your concern.
ما شاء الله انت تزعل مني انت جاهل.
أنا
Okay,
بسأل.
خليت لك
time is up.
concern.
Okay, time is up.
Okay.
Dr. Mahmoud
Okay.
will comment.
Yes, Dr. Sarah. Well done, Dr. Sarah. Yes, well done. But the explanation of you forget many. You forget some issues. Okay, at the beginning, the explanation of deep brain stimulation, just brief. We will fix some electrodes in the brain, in the parts which is responsible for your movement. These electrodes will connect it to a pulse generator. This pulse generator will be in under the collar or at the abdomen, but usually it is under the collarbone. And through this pulse generator, it will connect it by a remote. This remote can control your movement because this remote can increase the movement or decrease the movement. Okay, that is the first thing. Second thing, it is the bad effect of the procedure. It will be like infection and bleeding, yes, but there is two things that may cause fits and may cause slippage or misplacing. So this is most important to explain this. Okay, and the third thing it will be after the procedure will give you a card to facilitate during passing through electronic gates in the airport and like that. Okay, and the most important thing you forget the concern. I asked it just communication, but you should. I think that you should ask me what's your concern. So my concern, it will be, doctor, it will be temporary or for life, permanent. Yes, that's my concern. You don't ask me my concern. Okay, this and this deep brain stimulation will not cure the Parkinsonism or will not delay the progression. Just to يعني improve the quality of life. Just to improve quality of life. Yes, it is not for cure or for progression. And yes, and the most important pulse generator may have like expiry date. May have to change the battery after 5 or 10 years according to the pulse generator. That is all. That is the scenario.
Okay. So please, Dr. Mahmoud, could you explain the procedure again for me? Yeah.
Yes, deep brain stimulation. It is a kind of surgery in which we fix some electrodes in the area of the brain, which is responsible for.
Yes, can I see electrode like this? Not jargon.
Yes, electrodes like ICD and yes,
wires.
All wires.
To say
wires, yeah. That is why I see. Yeah, I say wires. Yeah.
Yes. Okay. It is responsible for movement, and these wires will connect it to a pulse generator, which will be placed under the collar bone. It will be hidden under the skin. No one will recognize that. And this pulse generator will connect it to a remote. This remote can control your movement. Just يعني increase your movement or decrease slowly like remote control. And this remote may be placed away from electronics like the car battery and TV. It is that.
Mm-hmm. Mm-hmm. Okay, nice. Yes, and the concern of it can slow the progression of disease. Actually, I didn't sure, so that is why I tell you.
Yes,
Just control.
it is a trick,
Can control
but
your condition. Yeah, yeah.
Mhm.
I didn't sure
it,
regarding this one.
it just improves the quality of life.
Yeah.
They like this word,
Improve the quality of life.
quality
Okay.
of life. And also multi Dr. Sarah like ICD or any
Pacemaker.
or pacemaker, any electronic in the body. We will give you a card. This card will facilitate through passing
Mm.
any electronic gates like airport or any malls. Mhm.
Mm-hmm.
This
Okay,
case
thank you.
come many times in basis.
Yeah,
Oh,
thank you, Dr. Mahmoud.
Thanks, Dr. Bess.
Thank
first
you.
time I practice it. Yeah.
Yes, it looks like any procedure. The same
Yes.
ICD, the same pacemaker. It's a device under the skin which can be connected through a wire inside the body, either inside the heart or inside the brain, to control the symptoms. That's it.
Mm.
No need to go in more details because you don't know the details. We need some, maybe even the neurologist, maybe there is the advanced who practice or who experience this machine or this device, they can explain a lot. What I know, as Dr. Mahmoud mentioned, so there is device under the skin will be connected to a wire, reach to the deep area in the brain, and while controlling by the remote, the patient, whenever he has the symptoms, he can control and generate and this device, and it will control or make the symptoms better, simply and without complication. Otherwise, yes, there is complication, but you have to remember the epilepsy. Okay, it might lead to a seizure or to increase
Yes.
activity as a particular side effect related to this device. Otherwise, as every device and any procedure, it has side effects. Two eyes, two P's. Definitely, it will have two eyes, two P's. Injury or infection, P, bleeding or bleeding or pain. Because you are going to do a procedure. Any procedure, you can mention these two procedure as these two complication. You can add to them some specific, as in this scenario, the epilepsy or seizure might be a complication to this procedure. Otherwise, pre and during and after, you have to speak about all through the procedure. The consent form is something mandatory to be raised, and to have a consent at the end of this meeting, you have to sign and you can withdraw. Don't push him for the procedure. Don't tell him, don't waste the time, because it just improve the symptoms or the quality of life, but it will not cure him. Okay, because you are pushing him, you have to sign it early and not to waste the time. No, tell him, take your time, think properly. You can even counsel or ask opinion from other or a friend or your family, and whenever you are agree, let's do it. Okay, after signing the consent, the introduction and the closure, of course you have to ask about the social support with whom you're living. Does you need or does he or she need any support, or do you need any support? The driving, I agree to stop because he has some tremors, or you can ask if there is impact or no. But I agree, even for the procedure itself, you can postpone the driving and you ask someone to drive him home, because you don't know what the drawbacks after the procedure. The last thing, yes, the advance directive, it's good to mention if you have time. Yeah, if you are planning for something in the future. But if you don't have time, it's not something to be necessary to discuss. Okay, so the procedure itself, it will take time with drawing and everything. Any question, Dr. Sarah? Any comment, Dr. Mahmoud?
No,
Um,
Dr. Basim. No, thank you.
Okay.
yes, actually, Mr.
Just,
Basim, it
yeah, I'm
was
trying to deal with this scenario, but
yes, it was a concern also. When I ask you, Dr. Sarah, when I have to take decision, you tell me as soon as possible. No,
Yeah.
take your time.
Exactly.
Yes.
Exactly.
yes,
Yeah. Don't
yeah,
push.
I mentioned yes, yes, you can take your time to think,
Exactly.
but also we advise you
Yeah,
do
advise you,
not
but yeah, don't
delay.
hurry, don't be a rush for
Yeah,
this
yeah.
procedure. Okay, as Dr. Marwa also, I want to stress on this point. If you are stuck with any scenario, procedure, you don't know the procedure and you don't know the steps of the procedure, just talk about the preparation before, pre or before, and during. You can draw, and after, taking care of you, monitoring you for some couple of hours. If you are okay, we can let you go home. If you have someone to drive you, or we can arrange someone to drive you home. So the main element of talking or counseling a procedure, just remember these three steps: before, during, and after. In between, you can manipulate, and you can add, you can remove according to the procedure. As in this scenario, you have to remember the seizure as a complication. Otherwise, the same steps. You will be admitted that the day of the procedure. You will be seen by a lot of doctors, some investigation and workup done for you. You will be shifted to the procedure room, numbing the area, cleaning the area. A pain management doctor will be there to have a look on you and to be sure that you don't have any pain. After the surgery or after the procedure, we'll admit you in a closed monitor area just to be sure that you don't have any complication. And you can talk a lot, or you can add some, or you can remove according to the procedure or the scenario. Okay. Anyone with question before moving to the next scenario? I will read the scenario, then we'll open the discussion. Mr. Watson, 40 years old. You are the medical doctor in the gastroenterology department. Mr. Watson was admitted 2 days back with abdominal pain and black stool melena. Patient received initial stabilization, including intravenous fluid, pantoprazole infusion, and scheduled for elective esophageal gastroduodenoscopy today. He was instructed to take nil by mouth in the preparation for the procedure. Currently, he is stable with normal vital signs, and the pain has improved. However, esophagogastroduodenoscopy was postponed because the team received another critical patient for emergency endoscopy. Whenever you're ready, Dr. Mahmoud, let me know.
Yes, read it, Dr. Bas.
You'll
Inshallah.
start.
Yes.
Any question before moving? Sorry, Dr. Mahmoud, I will ask. Anyone want to add anything?
Dr.
Yes, Dr. Huda.
Dr. Basil, can I ask about
Sure.
if when he asked this is temporary or permanent, what's the
Mhm.
answer?
What do you think, Dr. Huda? I will ask you this question.
I think permanent.
Why
I
you
think.
give a permanent as a permanent? Why it shouldn't be temporary? What do you think if it will be changed? So you don't know. The best answer is, what do you think?
Assess you.
Yeah, we will assess you. We will call the nerve doctor. He will assess you. If anything will happen, if you need it permanently, he will decide according to the manifestation. Maybe it will fail, right? If
Okay.
it will fail, they will remove it. Maybe it will be complicated with seizure, infection. They will remove it. So always be
Okay.
diplomatic in the answer. Don't give a clear cut of answer unless you know it clearly and you are sure about it.
Okay. Thank you, Doctor.
Okay, no stress. Any other question? Dr. Mahmoud, ready?
Read it, Dr. Bas.
Assalamu alaikum.
Alaikum assalam wa rahmatullahi wa barakatuh. Okay.
Only I want to ask something.
Yes, sure.
الله يديك العافية Mr. Basim. Only I want to ask something. In this procedure of deep brain stimulation, not all patients will go to this procedure. First, they will do fitness of the patient, because some patients, if they have severe disease and if not responding before to the medication, they will not go for this surgery. And also, we have to do CT or MRI to be sure that there is no any brain problems, any anomalies, or any
tumors like that. This is part of the assessment for the
Perfect.
procedure, and this procedure may be done in Aywa. Also, this procedure it will be done in it may be in a form of a wakeful surgery. That in this surgery we don't need to give any anesthesia for the patient. And another type of surgery we can give some numbness for the patient, numbing medication. I mean, يعني.
Yes.
I think also like pacemaker, like pacemaker of the heart. This procedure may be complicated by twisting of the
Yes. Wire.
electrode, so that I will advise the patient of the surgery. I want not to move vigorous exercise like that.
Yes, perfect. So again, it will go through the steps as pre or before and during and after. What you mentioned earlier, it will be under the term of prior or before. So we will be sure that you are fit for this. We will do some blood tests. We will do some scans to be sure that procedure will fit for you, right? So it's the same, but you make it in a different way. This is the main aim, is to remember the all steps of any procedure. Believe me, the procedure as a scenario, it will be the most easy and you can gain a lot of marks. Why? You have a lot of things to talk about, but don't forget, always after finishing every step or phase, you have to ask the patient, are you understanding me? Are you following me? As well as don't repeat the name of the patient, which is already repeated, Dr. Sarah. This step, this defect, still you are doing. You are repeating Mr. Sami a lot during the scenario or during the discussion. Try not to mention it. So you are talking friendly with him. No need to mention his name every now and then. Then the complication, as the doctor mentioned, after this procedure, we will be sure that nothing happened, no complication. I think all the comment still goes with the steps of or the phases of any procedure. So the take home message of this scenario, whenever you have a procedure, talk it in these steps before, during, and after. Okay. Sorry, Dr. Mahmoud. We will. Okay, Dr. Sarah is asking about the scenarios. Okay, someone will share it. Thank you. Any other question or comment or suggestion? We can start if no comment. Okay, Dr. Mahmoud, here you go.
Okay. Okay, good evening. I'm Dr. Musa, doctor in the clinic today. Let me confirm you are Mr. Watson, 40 years old.
Yes, doctor.
Mr. Watson, we are here to discuss about your medical condition and update you about your condition. Is it okay with you?
Yes, okay, doctor.
Okay, Mr. Watson, before we start, could you tell me how do you feel now?
Yes, doctor, I'm fine now. But doctor, I'm waiting. Yeah, for the camera test that should be done for me, doctor. So no anyone come for me for this. So what happened, doctor?
I am really sorry for your any delay, Mr. Watson. But before we start, could you tell me how much you know about your condition to be in the same page, please?
Yes, doctor. Before 2 days, doctor, I came here because I have some pain in my tummy, and yes, my stool become more black, and I received some fluids. Okay, and some medications, and at that time, they said to me, need to be done for you, for me, a camera test. So I am prepared myself, and now I'm fasting until now.
Yes,
So I'm waiting, doctor. Yeah.
Yes, Mr. Watson, I do understand your feeling. Mr. Watson, you are supposed to going to camera test, but I am unfortunately it was unpredictable. We had another patient which had been complaining from horrible bleeding. That's why the team assess your condition. And as the another patient was horrible bleeding, can't be waiting for after your procedure. That's why he is going now in the theater. And I'm sorry to you that we postpone your procedure for some times. I'm sorry for that,
Doctor,
Mr. Watson. Mhm.
Doctor, you mean that you are not going to do for me this camera test? Why, doctor? Why is like this, doctor? Yeah, doctor, I'm waiting a long time. I'm fasting, doctor, and now you came here to tell me no camera test. Yeah, to be done for me, doctor. How
I,
this, doctor?
I really appreciate your words and your feeling, Mr. Watson, but I don't mean that we cancel your camera test, but just we postpone the appointment just for sometimes, and I will update you further when exactly you will go to camera test. I am sorry for that, Mr. Watson, but it is unpredictable events that we
Okay, doctor. Why?
face.
Yeah.
Okay, go on, Mr. Watson. Yes.
Yes, doctor. So why you want to postpone this? Yeah, doctor. Yes, me also. I have bleeding, doctor.
Yes, I do appreciate that, Mr. Watson. But we assess your condition. Your condition now improved, and also, as you mentioned, you have been admitted here due to blackish stool. That means that there is bleeding in your gut, and we assess your condition, and that's why we postpone your procedure. I'm sorry for that, Mr. Watson, but it is unpredictable events that we face in our field.
Okay, so
So
doctor, you mean
how
that
does sound?
just yeah.
Yes.
So doctor, you mean that just because of my condition now becoming stable, that is why you postpone this camera test for me?
I really understand your concern, Mr. Watson, but I don't mean that you because of your condition is stable, but because we have another patient which have a horrible bleeding. That patient can't be waiting. That patient can't be waiting. It is a life-threatening procedure for this patient. How does it sound with you, Mr. Watson?
Okay, so doctor, I want to go home.
Can I know why you want to go home?
Yes, doctor, my kids and my wife, they waiting me at home, doctor. So how can I stay here without this camera test?
Yes, I can imagine that, Mr. Watson, you are worried about your children. But let me explain to you the seriousness of your condition. You have been admitted due to blackish stool. That means that you have bleeding in your gut. And we need to know the cause of the bleeding. Maybe cause of the bleeding, maybe because of some soreness in your gut, maybe injury to your gut. But what we are concerning is maybe might be gross or nasty gross. That's we are concerning. And besides that, Mr. Watson, staying in the hospital, we will give you nearest appointment to the camera test. And I am afraid if you going home and you have also this bleeding from back, this bleeding, you may collapse, and I'm sorry, it will be sinister thing for you. How does it sound with you, Mr. Watson?
Okay, doctor. So now, doctor, I need to break my fasting, doctor.
Okay, yes, I do understand your worry about fasting, Mr. Watson. Okay, I will ask, I will assess this with my team. If we are going to do this procedure next hour or next hours, I'm sorry to you that you should still fasting. But if the appointment may be far, okay, I will tell you and update you to break your fasting. How does it sound with you, Mr. Watson?
Yeah, okay, doctor. So now I didn't get you, doctor. You want from me to break my fast or not?
No, Mr. Watson, I will revise it with the team, and I also ask the consultant of if your appointment near, no, you shouldn't break the fasting. Do you have any concern, Mr. Watson?
Okay, doctor. So when you can do for me this camera test, doctor?
I assure you, I do understand your worries, Mr. Watson, but I assure you it will be as near as possible. I will contact the consultant and also the team of camera test and update you near, inshallah.
Okay, doctor. Okay.
Okay, doctor. Okay, Mr. Watson. Mr. Watson, do you have any concern?
No, doctor. Thank you.
Can I ask what do you do for a living, Mr. Watson?
Yes, doctor. I'm teacher.
How much is your symptoms impacting your job or daily activity?
Yes, actually, I didn't able to go to my a job because of this condition, doctor.
I'm sorry for that, Mr. Watson. That's why we need to do camera test as near as possible. And I assure you, I will revise it with the medical team and give you nearest appointment.
2 minutes left.
Do you smoke, Mr. Watson?
Yes, doctor.
Can I ask how many cigarettes and for how long?
Yes, since 5 years, doctor. I like 10 cigarettes per day.
Okay, Mr. Watson, I strongly advise you to stop smoking because it may have a risk on your health and on your condition. That's why, if you want, I can refer you to smoking cessation clinic. They will help you. Do you drink alcohol, Mr. Watson?
Okay. Yes, doctor.
Yes, I also advise you to moderate your alcohol intaking at this time because also till we diagnose you and give you suitable treatment. Mr. Watson, about your children, anyone can take care of them at the home?
Yes, doctor. My wife, yeah. There.
Okay, very good. Are your wife able to support them?
Yes, doctor.
Okay, Mr. Watson, at the time being, I will give you some brochure and leaflet about the camera test and also the causes of bleeding in the gut to explain the seriousness of doing this camera test. And I promise you, I will give you as soon as possible nearest appointment. Thank you, Mr. Watson.
Okay, thank you, doctor. Thank you.
Thank you.
Okay, time is out. Dr. Sarah, comment.
MashaAllah, you did well, Dr. Mahmoud, MashaAllah.
Thank you, Dr. Sarah.
Yes, just apart from few comments. Yes, when you are started, yes, should prioritize the other critical situation of other patients, the critical situation of other patients. So that is why we need to postpone it. And also, when the patient asking regarding the fasting, it should break the fast now. Just yes, you address your concern well, but also we can add for him if you are break your fast now and you have developed any bleeding at any time. Sometimes we need to to do for you this camera test as emergency situation. So that is why we advise you do not break your fasting. And also, if you are break your fast, the procedure itself, it can be delayed and can be do after. It can be done after 6 to 8 hours like this. Yes, we need to go back to the team and the consultant to see what suitable time that it will be done for him this procedure. Okay. So also when we ask you regarding I need to go to home وكذا. Okay. Just we need to talk more regarding the seriousness And yes, we need from you to stay here in the hospital just to monitor you. And if you are develop any bleeding at any time, like this, yeah.
Mhm.
Apart from that, yeah, you did well, mashallah. Perfect.
Okay, thank you, Dr. Sarah, for the scenario. Well done, Dr.
Yes,
Mahmoud.
thank you.
Thank you, Dr.
But I
Qasim.
will ask
Thank you,
Dr.
Susan.
Mahmoud.
Yes.
Yeah, I'll ask you. From where the cancer or the nest growth mentioned in the scenario?
Yes, this also I forget it. Yeah.
Yes, seriousness.
Okay,
Really,
seriousness, but without inventing.
I escalate
Yeah,
it
not mentioned in
from,
scenario. Mm.
but might be cancer.
Mm. If there is possibility, they will write for you and you can mention it.
Mm.
Otherwise, you don't know what's ongoing. So we are screening every cause. If she asks you, was could be a cancer, yes, you can say, but why you are raising it?
Mm.
They might say you are confronting the patient, and the patient will go with you in a dilemma of, oh my God, I have
Yes.
a cancer, doctor, and he will cry. Maybe it's just simple duodenal ulcer or gastritis. Okay, so don't add idea from your mind.
Yes, Dr.
Okay,
Qasim. You're right. Mhm.
agree, right?
Yes. So
I
I.
tried to review the scenario again to read any cancer or possibility of cancer. I didn't find. That's why I was wondering. But anyway, you are doing well in the whole scenario. You know to address how, or you know how to address any concern and to answer any and to find any solution for any concern. Yeah. For the fasting time, I agree also to mention, I will call the team. You don't have the answer now. Maybe the reschedule will be soon or it would be later on. So you can refer and they can reschedule him or they will tell you or update you about the new appointment. So don't keep him MPO, don't let him break fasting, but you can refer or you can ask from your junior, sorry, your senior, or you can ask the team, the camera team, camera scan team or camera test team, and he will update you. Then I will have a meeting with you to update you about the next appointment. This is regarding the fasting or MPO. The next point or concern, why we postpone yours. It's very important to mention the other patient life-threatening condition. Not only he has admitted or we have another case. No, it was a life-threatening condition. You didn't mention it, right?
I mentioned it. Horrible
You
bleeding.
mentioned life-threatening or you said the severe bleeding. You didn't say his life was threatened by this bleeding.
I don't I don't know. I don't know.
Anyway,
Yes,
anyway,
he mentioned just also
severe
we need
bleeding.
like if this procedure yes it doesn't done for him, he can die, just like
Okay,
this.
yeah. So you have to mention the
Mm.
seriousness of the other patient. It was life-threatening condition which he cannot wait. For you, we already have vitals or monitored you, and your condition now is stable compared to him. Because otherwise, what he will tell you, doctor, I'm also having a very serious condition. What do you think? So you have an answer for him. No, his condition or the one we already did the procedure for him, he was having life-threatening condition. Means that he will lose his life if we didn't interfere. For your condition, we already monitored you. We give you some medication to control the bleeding. However, it will not be cancelled at all. Just postponing to another appointment. We reschedule you and we'll let you know about the appointment. Okay, we will try to make it as soon as possible by our camera scan team according to their schedule, and don't promise any patient. You told him at the end, I promise you. You are promising, but you don't know the schedule. You don't know the anesthesia team schedule. So don't promise any patient or surrogate in the basis, even in the practical life. Yes, we will try, but I don't have any guarantee that it would be done. Maybe
Mhm.
something technical will happen, oxygen disconnection, anesthesia busy, another life threatening. He will blame you, doctor. You promised me earlier. Why you promised me if you don't have the guarantee about this procedure, right?
Mhm. Yes, Dr.
Okay.
Qasim.
Then the next, the social, of course, you have to support. And whenever he mentioned the kids earlier, you can address it. Sorry about your kids. I can see how much you are caring about your kids. And don't worry about that. We can, if you can address someone or call someone to take care of them, look after them, any relative, any neighbor, or with the mother. If the mother needs any support, we can help her. I I I think if you address it earlier, it would be better because it will save time, and you will reassure him earlier. Then you can ask about this, the support at home, the job, smoking, alcohol, and if he insists to go home, what do you think you have to do?
Yes, he is right to go home.
Exactly. So
Yes,
you will
sign
mention
them.
and you will exactly you explain the seriousness and continue.
I will involve the consultant.
Okay.
Then
If he is
them.
insisting, exactly,
Yes,
Dama.
Dama and go home.
Okay, if he's already about to go home at the end of the meeting, by the way, it will be another scenario. So the scenario will go through the steps of DAMA and sign the discharge against medical advice. What do you think it would be very important to speak about before he will leave?
Yes, there's a safety netting about any
Perfect. Yes.
your stool
Yes.
black.
Exactly. Whenever you have severe tummy pain, whenever you have another attack of black stools, or passing a lot of blood, or feeling dizzy, okay, or a severe tummy pain, as I mentioned, please don't hesitate to call us or to come immediately to the emergency department. Okay, this is his right still, even he will sign them to offer him the service. Clear?
Yes, clear, Dr. Bess.
Okay, please again, don't add ideas not written in the scenario. Even it will be correct. Unless he asks you about, you can, yes, say it. But if not, don't raise it by yourself. What the possible cause, you don't know. Even it's not mentioned in the scenario. Unless it was written in the scenario. Alcohol related, smoking related, non-steroidal related, you have to mention it. I encourage you that time to mention it. It could be related to that. Otherwise, don't talk about any possible cause unless he will ask you, doctor, what do you think the cause of this bleeding? You can mention it might be drug related or smoking or cancer even. It could be one of the possibility, but it's unlikely. Or you can give some instruction since you are not having the symptoms of loss of weight or loss of appetite, so it might be not cancerous lesion. Otherwise, as general performance, perfect, Dr. Mahmoud.
Thank you, Dr. Bess. Thank you, Dr. Sam.
Okay, you have any question or concern?
Thank you, Dr. Bess.
Dr. Sarah, you want to add anything else?
No, thank you, Dr. Basim.
Okay.
Sorry, Dr. Basim. Hi.
Yes, Dr. Maida, how are you?
I'm fine, thank you. I just in the beginning of the scenario, after you come to the patient, I think it's better to say, like, asking about his symptom now, how you feel now, before you give him the news that you will not book him in the camera test today. So ask him about his symptom, how he feel now, and then he will express his that he's angry about that his camera test has been postponed, and then you tell him that we always prioritize the patient according to the severity of the disease, and that why there is an emergency, and whatever you said that there is an emergency case, that's why we give priority to that one. But we are still, because some patients, they will feel that neglected, that if that patient is important than me. So you can still say that we think your condition is very important, and we still need to exclude that there is no bleeding, but we think your condition is stable now, and waiting is not affecting your general condition. And as far as we are monitor you, so it's important to let the patient think that we still caring about him, not just because there is an emergency we are just let you waiting.
Yes, perfect idea. Good idea. By the way, I encourage not only this scenario, how do you feel? How are you now? It's something to make a patient feeling calm and comfortable to talk with you. Not only in this scenario, any scenario, whenever you are going to the patient, introduce yourself, confirm the data of the patient, you can ask him, how are you? How do you feel now? Particularly if he has presenting with something very serious or severe. So it's not only as a scenario related to bleeding or something acute, even patient with having suffering due to chronic illness, multiple sclerosis, or systemic lupus. How do you feel now? Are you feeling okay? Something make the patient or surrogate feel comfort, and he will open up with you and discuss what he's feeling, as Dr. Maida mentioned. Yes, any other concern? Thank you, Dr. Maida, as usual. Good comment and valuable one. Any other comment? Okay, I will read the comment quickly. How come, Dr. N? Well done. Thank you, Doctor. I agree. How come the patient will be fasting and not able to break the fasting despite no exact time for done the endoscopy? Yes, in the scenarios, either it will be written as a clear timing for the next appointment, or it will be like this vague, and they will test you how to deal with this situation. Don't think that they will give you everything clear and ready to discuss. Sometimes it would be a hidden agenda during the discussion. You will be surprised of this concern. Oh, doctor, I will be MPO, or you will give me food. So you have to think quickly, right? The best answer ever, whenever you are stuck with timing or about information, to refer it to the team. Even if you are one of the team, like you are the senior gastroenterology or the senior hepatology or whatever the specialty, if you are in the task, the specialty or the specialized team, you can tell him, I will ask my senior. It's not something wrong to mention, but to be safe, better than mentioning something will be wrong. Okay? You are not a consultant by any way. This scenario is not for consultant level. You are still either senior house officer or registrar or even senior registrar. Still, you can ask your senior, or at least you can ask the consultant if something very serious and important. Otherwise, you can tell him, I can ask for help, then I will be back to you, update you about the concern. Okay. Dr. Sahla? Dr. Soha. Very informative. Thank you. Lovely scenarios and performance. Thank you, Dr. Sahla. Or Dr. Soha, sorry. We can support you with some fluids if needed during waiting time. Definitely, he will be, as Dr. Maida mentioned, you have to reassure him that we are taking care of you. We didn't ignore you. We just postpone your procedure, but we will be back with you for your procedure along with the monitoring. We are continue monitoring you. We will continue supporting you, giving you the medication you need, and we will observe the bleeding. We can do some blood tests to be sure that your blood is not low. Whenever you have low blood count, we can also give you a blood. Okay? So it's a matter of reassurance plus like feeling sorry. No apology here, by the way. No one will say, I apologize for this. It's not a mistake at all. Something happened, emergency or life-threatening condition which need to be prioritized, as Dr. Maida mentioned, prioritized to be done prior to him. So it's a matter of priority. Whenever we have two cases at the same presentation, same diagnosis, we have to prioritize which one need to be interfered with earlier and which one could be postponed. If you have two teams, they can do the same procedure at the same time, you can do them. But it's a matter of basis exam, how to, they are testing you how to deal with these scenarios. Okay.
Also,
Oh,
regarding the keeps fasting, and this we can also just add like at the moment, I prefer to keep you fasting until to come back to you after asking your parent team about what the next management plan. So to just ensure him that at the moment I will keep him fasting, but I will tell the parent team so they can decide whether he can go further for to break his fast, or they will do the procedure as soon as possible. But
Exactly.
also, I think Dr. Mahmoud said well that the procedure may be done at any moment. Uh, it can be at any moment. It can happen. So just to tell the patient that at the moment he need to be fasting anyway, if until we have a clear plan.
Yeah, the same concept. So you will refer, don't give decision. Don't give a decision right now. Why? Because if you break MPO, they might give him appointment after 1 hour and you'll be in trouble. It will be postponed for another 6 to 8 hours. He should be break MPO again and you will be in trouble. So you postpone him by a mistake. And this time you will apologize. Sorry for this decision. So the best way and the safest answer, as Dr. Maida mentioned, we will be back to you after seeing your opinion. Why? Because it's a major and maybe vital decision. If you give him the decision, maybe you will regret. Okay. Thank you, Dr. Maida. I read a question now from Dr. Marwa just now. Sorry, Dr. Marwa, I just read it about the future plan. Yes, she was meaning the advanced directive and lasting power of attorney. I mentioned during discussion, if you have the time to talk about it, but I don't think there is a time to talk about the advanced directive or lasting power of attorney in a procedure task. Why? Because it's something for the meanwhile. What I suggest to do, if you have a scenario about Parkinson management and the counsel about the Parkinson, what to give the patient, how to manage, how to deal, what the possible option. Yes, this is the time to talk about the future plan. Are you preferring such a specific or particular plan regarding your medical management? Because it's something need to be followed for a long time. But for the procedure, you are talking about something for meanwhile. It's something today and tomorrow will be observed. Maybe after 1 week there is complication, follow up. Still, you don't know the progress of it. And the task itself, it will take time. Maybe this 10 minutes will talk about the procedure and before, during, and after the possible complication. But if you finish the whole task, the drawing, the complication, the consent form, you can say and you can ask about what do you think about this plan in the future? Are you willing to do everything? Because once the patient reach the level of deep brain stimulation means that he's an uncontrolled one. He might have progression and he might have also cognitive dysfunction in the future. So it's 50-50. If you have time, you can go proceed with it. If no time, just abort it. It's not something necessary to raise in such scenario, particularly the procedure itself. So whenever you have procedure, please spend a lot of time talking about the procedure, the steps we mentioned, plus the consent form. This is the fatal things you have to talk about, or the vital things. If you missed any of them, they might minus you. But if you miss the advanced directive in the procedure scenario, I don't think they will minus you. Adding to them some instruction and safety netting. Please don't do the excessive exercise. Don't go through the gates without showing them the cards. It's very important. Why? Because this device might be aborted and might be distracted because of magnetic field. For example, MRI. Those patients cannot go to the MRI with this procedure, or sorry, with this device. It might be distracted, right? So rather than talking about advanced directive, give him some instruction about the care of this device. Clear now, Dr. Marwa?
Yes, clear, doctor. I just want to clarify this point. This is not necessary and not wrong at
Yeah,
the same time.
exactly.
This is mean
Yes, exactly.
because
Yes.
this is first time to raise this issue during a procedure. So I want to clarify this point. Thank you.
Yes, perfect. So it will not harm you if you raise it, but it will harm if you raise it without talking about consent. For example, they will write in the feedback, you discuss advanced directive without offering the consent. So it's not something to be raised necessarily unless you finish the whole task, including the instruction, by the way, at the end. So I don't prefer to raise it because you don't have time. You don't have the time to do it. But if you have and you explain what I mentioned earlier, now the time you can ask about it. Of course, the social is more important, the driving, but the advanced active in such scenario, procedure scenario, I don't think it will make sense. Okay. Any
السلام
other
عليكم أستاذ
question?
باسل.
وعليكم السلام ورحمة الله وبركاته.
بس عايز أتكلم عن نقطة كده بسيطة regarding the procedure.
Yes.
ديت 2 كان في قطر الكلام ده جابوا presenting a case with the case for colonoscopy, but the patient cannot tolerate the bowel preparation.
Yes. Yes.
Okay, I think I remember this case.
Yeah.
Okay, and to sit with the patient and discuss another option, another alternative like CT with like CT. They don't mention CT with contrast or whatever. They make it open. Just just sit with the patient and discuss alternative. What I want to talk about, the feedback came like the candidate sit with the patient and talk about the procedure so that the patient get afraid, get scared. You make the patient scared and the patient will not go for the procedure.
You mean the main procedure, which is colonoscopy, or the
You got my
alternative?
point? No, the alternative. The alternative. There is the alternative. What will be? It will be CT with contrast. You need to explain to the patient what CT with contrast means that way, and this contrast has side effects. You need to give you fluid before preparation, and the contrast may injure your kidney. Blah, blah, right, like this, right? You will mention the side effects and everything. Their feedback, it came like the candidate make the patient scared.
No,
He mentioned a
I
lot of
disagree.
side effects.
Yeah, I disagree, wallah. Yeah. So you give me
Examiner,
the options.
you know the examiner.
Yes,
You know
I
the
know.
examiner, yeah.
That's why I'm always saying it depends on the examiner wish and how is his mood that day. Some examiner will accept, but by the
If
way,
you don't
logic.
mention, maybe they were right. A candidate didn't mention the side effects. If you mention,
Exactly. So it's not a rule, and in this situation, I have to speak about the advantage and disadvantage.
the
But
side
maybe,
effects, yeah.
Dr.
By the
Ahmed,
way,
maybe the way the way he presented was confronting. Okay,
yeah,
I
this
don't know.
is the feedback of one of my colleagues actually.
Yeah, that's why maybe he speak or he spoke like, if you do this, you will have this side effect. So please think about it more. It's the most wise one. So you get it. Maybe the way he presented was confronting, and the patient feel afraid of it. I'm
Maybe
not sure
stressed,
also.
yes, too much on the side effects.
Yeah. Sometimes if you talk and the way you are talking, the tone, even the tone, you stress about
Yes.
this disadvantage. Yeah, they can understand that you don't want him to accept the procedure. So
Very
they will
important, yeah.
exactly always be neutral and don't give further side effect. Yeah, be honest, but don't
Yes.
stress. Yeah, and don't confront. This is the main role. Don't confront the patient.
There is unwanted effects, but regarding these unwanted effects, we will guarantee that we will follow you and monitor you every time.
Exactly. Yeah, always give the negative and reassure.
Yes.
Yeah, that's the best advice. Thank you, Dr. Ahmed.
Yes.
It's good also to hear about these feedbacks because you don't know, maybe you will sit with this examiner one day.
Yes.
May
So
may
just
Yes,
just a
Dr.
point that don't go through the side effects of if you have some procedure, don't go too much deep for the side effects of the procedure. Just touch it and reassure the patient.
Yes. But by the way, you have to explain the side effect. I know one doctor, he said one day, because I didn't mention the side effect, they minus me. It was a scenario of steroid. So be neutral, mention and reassure. Yes, as you said. Okay, Dr. Mahmoud, sorry for interrupting you.
No, but I think he mentioned يعني the examiner needs that solve the bad effect. Even يعني that the patient might have kidney impairment or affect the kidney, but
so
will be
give
sure
hydration.
that hydration, yes.
Yeah, the way I said, as I said, the way you present and the way you talk about or you spoke about the disadvantage, maybe the surrogate felt like you don't want him to do. You are pushing him not to do. Maybe this is the point. So we are giving the option as alternative. No need to stress because he has the right to choose. Okay? Don't push him unless it was written there, this is your task today. If the task is about this procedure
Actually,
only, continue.
Actually, they want you to sorry, okay.
To give an option.
Actually, they want you to give the option, but at the same time, they want you to convince the patient to do a bowel preparation, to try bowel preparation once more.
So you will start with the trial first. Yeah, you will start first with the trial. If he will not accept, you can proceed with the other option with the neutral. Exactly.
Yes.
Particularly, the task is written there. Find another option, as you mentioned. But if they are if they are talking about the task, convince the patient. So yes, I agree to mention all the side effect of the alternative. Okay, since they are writing in the scenario, there is another option. Speak about possible other option. You can talk about everything. But if they mention, no, please try to reconvince the patient to rearrange for him the same procedure. This is the time to speak about the task, stick to the task, and you can even now talk about the side effect and try to push the patient to the main task, which is the main procedure. You got it?
Yes, yes.
Okay. I hope it's clear for all. Okay, thank you, Dr. Ahmed, for your feedback. Any other question or comment? Any suggestion? Any point need to be clarified? Okay, chat sets message, nothing new. Yeah, we need, Dr. Sarah, we need to emphasize on the issue of justice and explain that we treat all patients same regardless of their color, beliefs, or religious. And the only preference is that the other patient life is at risk and we need to save his life. Perfect. Very wise comment. Thank you, Dr. Sarah. Okay, so I think time to end the session if no more question. We'll see you tomorrow, inshallah, with the short clinical day. Thank you, Dr. Mahmoud, Dr. Sarah, and thank you everyone for the attendance. See you tomorrow.
Thank you, Dr. Bassem.
Most
Thank you,
welcome.
Dr.
Okay, see you tomorrow, inshallah. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.